Ladies and gentlemen, welcome to Triple N Media. I am Dr. NIK NIKAM, and today we have two special guests, Dr. Manju and Dr. Nisha Sundaragopalan. And just earlier we had a talk about heart disease, which I talked about. Then Dr. Manju talked about holiday blues, holiday stress. And now we're going to have Dr. Nisha Sundaragopalan, who is going to be enlightening us on dental care for the elderly. You know, I am in that age group. First I lost all the hair, next eyes, next teeth. I think teeth are the most troublesome problem I had to tell you as we become seniors. Maybe you can give us some very important tips on, what are all the different kinds of problems you see in the senior citizens group, and how do we deal with this? What are the complications if we don't take care of this? So I let you take over and tell us, all the things that we need to know, because I desperately need help.
Sure, definitely. And actually, as a matter of fact, when you call aging, when like you talk about white hair or or the vision reduction, but teeth is the other way around. Yeah, we will have attrition, wear facets, like wear and tear, but the actual fact is, if we can keep our teeth clean and maintain a regular cleaning, you don't necessarily have to have a lot of problems when you get older. So before I joined dental school, I have seen my grandmother wearing dentures. Yeah. So I really thought that when we all going to get old, we're going to have dentures. But then after that, going to dental school, I realized even 90 plus people have all the 32 really? Teeth. Yes. And I have in my office, I have 90 plus years of age, and my oldest was 96. She's no more now. But she almost had like 27 teeth, Manjulaji. It's like, for me, I'm like, that's impressive.
That's like something unheard of in Indian population or the American population, because the ones Nisha, it's kind of strange. I deal with a lot of, senior citizens as a cardiologist. I hardly ever seen anybody, who has all these teeth, and I'm surprised that you say at age 60 or 70 or 80, people can have full teeth.
Oh, even 90 plus, that's what I said.
What is the secret? You really need to tell us.
Oh, its secret is like very simple. Do the regular cleaning. Make sure you're not a victim of periodontal disease. Because in the Indian population, it's like it's funny, have you heard they say, and when they sit on the chair, sometimes they ask me that the cleaning does not destroy enamel. And like, that's the first question they ask me. So I'm like, no, the cleaning protects your enamel. Some of the patients, even here in US, I would be so surprised, like even women, a lot of them, the front teeth are loose. Yeah. And then we do something called periodontal splinting. And we stabilize, we remove all the debris, tartar, calculus. And once we stabilize it, then the periodontal disease is brought under control. But if they do regular perio maintenance, like the gum disease is under control, then, loss of teeth is something, it might not happen.
Is that right?
Yeah.
That's very encouraging, and that's a pretty good, strong statement. So what are the other kinds of dental problems you see in the American population, and how can they take care of this? This has to start at a very early age, from what I hear from you.
Yeah. So on the other hand, when we have since we are from Indian heritage, so the Indian heritage mostly like periodontal disease, but the caries activity is less. Gum disease.
Gum disease, okay.
Yeah, and the caries activity is especially little less compared to the periodontal disease, predilection. And prevalence. But when it comes to because the type of sweets we make, right? So a lot of the desserts and sweets halwa is coated with butter. So they say that the caries activity is comparatively less, but whereas American population, it's like more sugar, and so they are very prone to decay. But in elderly, one of the slides that I have presented it to you, it clearly shows it's close to the gum line, the elderly decay.
I see.
So the paper that I got published on my master's thesis is also on the cervical caries, which is the gum line caries.
And so do the gum lines recede as we get older?
If you maintain your periodontium, your gums, then you're not even going to get recession that much. But if we don't, then obviously there will be recession, and what called as black triangles form in between the teeth. And she might have seen in her clinic a lot of older women with a lot of black triangles, because that's a part and parcel of, like, women when they go through their hormonal cycle and things, gum gets a major impact.
Well, talking about gums, as we get older, then there's a space between teeth where the food gets stuck, and that becomes a nightmare.
Yeah.
To get it out of it. It doesn't matter how many different equipment you use. It's not easy to get it out. Sometimes the fibers get stuck. So how do we deal with that?
So the first thing
You're
people
laughing
try
at
to
me,
do. I mean, before I went to dental school, even I would have done all of that. I mean, I used to chew on my nails and things like that, and chew on eyes. But then once we go to dental school, then the whole dental education part comes in, and that's why these type of discussions are very helpful.
Talking about dental education, maybe they should teach this to the school kids.
Yeah, of course, we do that.
How often are these things taught in school?
I mean, now how the education, the subjects are very different than the olden days. The olden days, they always had focus, right, Manjulaji? Like, they always had focus on the general health, some kind of, like, dental education was given, brushing technique, dentists used to go give presentations. Now also they do, but, like, there's so many things that came in. So people don't do that too often. Yeah, so it's kind of tricky.
Manju, you see a lot of patients, young and older patients. What kind of problems?
So can you talk about gum disease in diabetics, which I see more often, the periodontal disease?
Yeah, so in the diabetes, since it's like a, what do you call that, as a micro, what is the microcirculation. So the dental pulp, it is also microcapillaries. So because of that, the diabetic, and also plus the gums. So it's usually the diabetic patients, they have a connection with the gum disease. And the gingival crevicular fluid is a little bit more detailed, but it will harbor more purulent bacteria. So it's more immune. It's also, they have this autoimmune immunosuppressive condition. So they're more prone to gum disease in diabetic patients. So if their blood sugar is balanced all the time, if they can keep it under control, we always, and nowadays diabetic patients are pretty well educated. They know about the A1C. They're far more educated in that aspect when compared to our dental. I don't know why, but I wish they can do more of the dental, especially in geriatrics. Yeah.
Why do these teeth decay as we get older in those people who are losing teeth?
Yeah, number one is saliva. So when the saliva goes down when we do get older, so that does happen. And that's why we have salivary substitutes, we have xylitol gums, and those chewing pills where the saliva gets stimulated.
Yeah, you see, I was doing some research. I found out that tooth decay, gum disease, receding gums, dry mouth. They didn't mention about food getting stuck between the teeth.
Speaking of the food getting stuck, the first thing is a toothpick, and we tell them don't use toothpick because
no, that's harmful because you're hurting the gum.
Yeah, exactly, and it perfectly fits into that black triangle.
Yeah.
So then our cells are harming our gums. So floss, and nowadays we use water picks. So water picks is a very good option. It's not a substitute to dental flossing, but definitely it's an adjunct. Yeah.
That's
so
good
there
to
are
know.
different kinds of dental flosses. Which one would be the best one, least traumatic to the gums?
Gums, dental tape. I like the dental tape better than the actual thread floss.
Yeah.
Because if you overdo with the thread floss, it starts bleeding. Yes.
That's right. That's why I'm saying,
dental
we're doing more harm to the gum
Yes.
every time we put something around it.
I know.
Because the gums are already kind of fragile, and then on top of that, why do senior citizens get toothache every couple of weeks or couple of months? What does that signify?
I mean, many a times they're on, like the body changes, the blood pressure, and that does have an impact on the entire periodontium, the gums. and they might be on medications that can have an impact, and stress, blues. That goes in, because see, another big thing is I see the senior citizens in their Medicaid, Medicare plans, and the Medicaid, the adult Medicaid, the Medicare plans, there's only like Plan C, which has a little bit of dental in it. And even the open platform is very limited in the dental benefits.
Well, talking about this, I posted these questions we are talking about to WhatsApp groups to ask for questions. What would you like to know about? We've got a dentist coming on our talk show, and she said, first find out how do we determine what is the cost of a dental procedure, and what is the right amount, and how do we find out who is the right person to do it? Maybe you can tell us.
Yeah,
because
sure.
Every insurance you get, they pay like $1,000 or $1,500. That doesn't cover even even a cavity.
Actually, cavities, of course, root canals are pretty expensive.
Yeah, so it doesn't even cover root canals. So how do you deal with it? Because somebody said they quoted him $25,000 for 2-3 teeth problem.
25 grand, that's a lot.
Yeah, so when dental insurance is for the regular, not geriatric people, so they are like PPO plans as well as DHMO plans, and they can be fee for service, which is like when they pay cash and they get the treatment. And plus, if they have an insurance, they can reimburse themselves. But most of the time, the providers, we help them by trying to check with the insurance ourselves and try to get it reimbursed on their behalf, and the insurance will directly pay us. So most procedures will have like a copay, and the preventive procedures are, most of the plans in their PPO are covered at 100%. And if it's a restorative procedure, that like the root canals or those, or even extraction surgical procedures, depending on the plan, it can be 80% or 50%. That's where the cost goes up, because the insurance is only paying 50%. And if in the long run, if we can provide, get into a change where the $1,500 is fully used for the benefits for one teeth, or so that their out of pocket goes down, then their cost is, the burden is reduced. But whereas in geriatric patients, the seniors, they have the dental plan will provide them $1,500 to $2,000 depending on. The catch is, it's so sad, most of the senior citizens needs that gum maintenance, and that the scaling and root planing procedure, which is called as the deep cleaning, that's like the easy term, it's not covered. It's not a covered benefit.
I see.
And then even on the fillings, like the restorations, when they become expensive, because over a 3-month period, the amount accrues, so they will be able to pick one tooth to get a filling. So that's like a pick and choose, and it's just very sad.
It doesn't serve any purpose.
Yeah.
Because it's like almost deceiving to the point where you think you have some kind of coverage, but when it comes to the basic elements, it's not covered.
Yeah, implants are not covered.
So what is the best way for a seniors to approach this? Is having an insurance better, because some of them may be on the plan,
having an insurance is better.
Discount on all these expensive procedures, or go, just without insurance?
No, having insurance is better, and that's why doctors all over the world, including dentists, the general physicians and doctors, we are trying to get senior citizens more benefits, because as we age, our body just tends to get more problems, so it's always better to have benefits. So when people come to our office, we have insurance agents that work with us, so we give them, based on their eligibility, there are some companies, some corporate companies, like United, they do like a co-plan, like a health plan.
Oh, that's nice.
Yeah, so they'll allot up to $2,500, like you said, for that year. Most procedures, like we do it, they pay out of pocket and then they get reimbursed. So it's pretty helpful.
Yeah, the main thing the point I was trying to make was that, like, if you need an implant or something, even if we get a 50% discount, it may be far better than paying a full fee.
Yeah, and
without insurance.
yeah, unfortunately, most plans don't cover implants, and
I see.
implants are like more becoming popular.
Like a cosmetics.
No, not cosmetic, because see, dentures.
Yeah.
People are not liking dentures anymore.
Is that right?
Yeah, the body has changed, and we now 3D dentures are available. And they use the scanning technology, and they use a 3D printer to make dentures.
Yeah.
So that is getting there. But still, I would say if we do not lose teeth, it's the best. If we can maintain, prevention is better than going through a disease process. And what do you think, right?
Yeah,
so
absolutely. Prevention is always the number one key.
Yeah. And so we try to tell them, try to maintain, we try to save as much as possible on the teeth. Like not the cash wise, like save teeth. So if we can save teeth, that's the best. If not, then we look into alternatives. Root canals to save it better, but sometimes root canals do fail because of multiple infections. Diabetes is one big risk factor to have multiple infections. So then if that's the case, then you have to go through extraction. Then when you go extraction, it's either implant or dentures. And dentures is obviously it's like removable. And the plans only cover dentures for like once in 5 years. And many a times these older people, they forget and they lose the dentures. So it's like they're stuck without a teeth.
No, when they use dentures, can they have the same effect when they're chewing?
No,
versus
not,
having a teeth or an implant?
With implant, it's always good. It's as efficient as having your own teeth. But with dentures, it's definitely compromised. It's not like anything natural is always better than having anything artificial.
If you chew on a steak or like rough meat, I guess it's going to make a difference.
Oh yeah, of course. But I have patients in the past, they were able to adapt better. So in the past, they come and tell me that I have my dentures for like 10 years, 20 years, I'm very comfortable. But the newer generation of the older patients who are coming in, like the baby boomers and population, those people, I don't know, because our food has changed, the gum is less keratinized. I don't know what's going on, but their adaptability, because they always have pressure spots, they're not able to chew their food. We usually refer them to the prosthodontist, the specialist, to see if they can get like one of those 3D dentures, or like they can get like an implant supported dentures, things like that.
You mentioned something about dry mouth. Can you elaborate on that one? Because so what way to deal with it? Because we don't even know we have dry mouth.
Dry mouth is called xerostomia. That is the term. And medicines can cause. Cardiologists give medications, and one of the biggest side effect of it would be a dry mouth. So, and then age factor and any other autoimmune conditions can definitely reduce salivary output.
We just keep on sipping water all through the day? Is that going to help? Or
I mean, if water can help, definitely that's one of the things you can. And there is also for dry mouth, rinses are available. So the mouthwash, the dry mouth mouthwash can help us help to secrete more saliva.
Okay. Coming back to the toothpaste and mouthwash, maybe you can comment on do we need to brush our teeth twice a day, or use mouthwash twice a day to keep this bacteria out? And, I'm more concerned about the tooth getting every few weeks.
So on the toothbrushing, we always suggest 2 minutes, minimum of 2 minutes brushing. And we always suggest twice a day, definitely. And kids would be like, you have to keep reminders. Now there are apps to remind you. Some adults do forget. So that happens. But then mouthwash and flossing. Flossing is like something that's left out, but then it's taken for granted, but we always keep repeating, please floss, please floss. And there are so many articles and conspiracy theories about flossing too that's pretty tricky, but no, flossing helps, because basically, how are you going to reach out with a toothbrush in between two teeth? So floss is the only option that you have. And there's no point in just saying, cleaning hurts the enamel or flossing hurts the stuff. No, it doesn't. Those are like the myths, and myths has to be busted out. So because that's why we need to give more dental education. And Nowadays, the powered toothbrushes are pretty amazing. They have control on the setting of the brushing. And with the power toothbrush, people always use it like the regular brushing. So it's a little bit of modulation, more of like a rolling technique, but not like more like, even with the regular toothbrush, you're not supposed to do horizontal. It always has to be vertical strokes.
Oh, I see, like this.
Like up and down, up and down. Yeah, so that's what we always say. And then with a power brush, sometimes they do it too much. In a high setting, they would actually destroy the enamel.
Hurting the gums.
Yes, and the enamel too. The enamel does upgrade with the, and also with, people always are so fond of whitening toothpaste, but when you have like sensitive gums and teeth, you should just have to be careful about the abrasive content on the toothpaste. If it is too gritty, we always tell them, okay, tell me the combo of your toothpaste, toothbrush, and the technique what you use. Because toothpaste, I tell them, use like if you want to use whitening, there is a separate term called whitening for sensitive teeth.
I see. Okay.
In any brand, because whenever we don't specify brand, you know, we cannot, but we can just say, look for the in any brand that you like, go for the specific words, whitening for sensitive teeth.
I see.
And many a times when they are very sensitive, the toothpaste will specify like for sensitive teeth or gum protection. So look for those words.
I see. Yeah. You know, we talked about the tooth, gums, and something just inside the mouth, but improper dental care can lead to a lot of other diseases. Maybe you can elaborate on those.
Yeah, definitely. I was about to catch up on that since my PhD, that I'm the first year PhD, and I'm focusing on a couple topics. So one of the topics that we are focusing on is there is established a relationship between the bacteria that's found in the periodontium, in the gums, in abundant, is found in the brain plaques on Alzheimer's patients. So that's one type of bacteria, or 3 or 4 types, but they're specific in the gums and nowhere else in the body in a higher content. So studies, in vitro studies have actually established that the plaques are amyloid protein kind of stuffs, and so those are things that are found in the brain. Is actually, they say that the gingivalis type of bacteria species, so it secretes some inflammatory byproducts that's like toxins to the gums. It goes into circulation and it builds plaque in the brain. The exact mechanism is unknown, but at least we could tell them that there are more studies and journals and evidence-based now talking about regular cleaning can be helpful to at least reduce the occurrence of these, as well as at least to prevent it from getting worse, like Alzheimer's. So Alzheimer's is some crazy, you should have seen patients in your office, and it just makes us feel like, you know, we know as well. And then my endodontist friend of mine, he said his mom couldn't even know him anymore. It's just sometimes it's when pathetic. Very sad.
Ronald Reagan had this one, and it was pretty protracted.
So
Alzheimer's, it's a pretty tough life.
And then putting us through that process, it's even very difficult. Like, you know, I mean, I just don't want to go through Alzheimer's. So like, you know, a lot of us, we always talk about it as dentists. It's like, I mean, we see these patients and their family or their the caregivers at home or their nursing homes, they have to brush these people's teeth because they even forget brushing. And we sometimes teach them, but it's so important.
What about this mouthwash? They say 99.9% kills bacteria and whatever else is in your mouth. Maybe you can elaborate on that. But if we say bacteria is the culprit that can lead to Alzheimer's or any other much more infectious diseases, of course, endocarditis also, which can affect heart valves in susceptible people. So are these mouthwashes effective?
Definitely, when it says 99%, I mean, they're not going to lie about it. So it is effective. The only thing is the frequency of food intake. So once you do the mouth rinse, then you keep eating snacks, then the bacteria is just going to be, you eat on crunching and munching on food. So use the mouthwash.
Yeah, mouthwash and then go and take the Indian sweets.
Yeah.
Okay. So can I suggest something on that?
Yeah.
So as a functional physician,
Yeah.
we don't recommend using mouthwash too much.
Is that right?
Yeah, because the oral microbiome is the most important part of your integral immune system. So you can use maybe once a day, and that to dilute it at least 1:3, whatever brand of mouthwash you use. And so because the moment you destroy the oral microbiome, whatever you're eating is going to the gut, and the food that's in the mouth, the salivary amylase and the oral microbiome is required to break it down, digest it. So all that adds to the more inflammatory process as it goes along the gut. So as functional physicians, we do not recommend using
How about
that.
twice? Twice is fine. Because we go with the twice. It's like 2, 1.
Yeah, again, basically
Good
again,
discussion.
cutting down all the carbonated drinks and the sugary foods is the most important key for the oral health.
Avoiding all these sodas, which are nothing but sugar solutions.
Yes.
I mean, imagine a diabetic can't have 2 teaspoons of sugar in a coffee or a tea, but your Coke has 9 teaspoons of pure sugar in it, and nobody pays any attention. They walk into the restaurant or fast food and say, okay, I'll have a big triple mac or whatever that is, wafer, plus 32 ounces of drinks. I said,
Coke.
are you crazy? Yes. It's like 1,700 calories, and most of it is carbohydrates and fat.
Yeah, I mean, all these sodas, the carbonated drinks, it's not healthy. That's what we always say. A lot of sugar content in it. Yeah, I mean, we do agree to the whole good bacteria and biome. We do. Gut health is also given importance from our perspective too. But then, I mean, twice. That's why we said the frequency of food intake, especially sugars, is something we need to be watchful of. And we just said 2 mouthwash. We're not saying 3 or 4. 2 times mouthwash. Yes.
That's very enlightening. I learned a lot, and maybe you can summarize for the seniors, what they need to do, and also about the insurance, what's the best approach.
Sure, definitely. So when it comes to dental health, we need to make sure that we pay good attention from an early age. Not just when we get older, even when we are young, we need to make sure we need to brush our teeth twice. And it's like a simple 2-minute rule. You can set a timer in your cell phone or like any apps, and that will guide you through. There are so many brushing techniques tutorials online nowadays, and you can read the article from the ADA, American Dental Association website, or you can go online and make sure it's a trustworthy website, because there's so many out there. Anything that comes from the American Dental Association is something I would definitely recommend, or from the toothpaste company that if you're going to use, you can always look into some of the details. Plus, make sure go to a dentist. Yes, and I'm not just saying because I'm a dentist, but we need to make sure dental cleaning is very, very important, and we need to go for regular checkups. You guys have to go for the medical doctor, the yearly checkups, and I don't know if you guys do the 6 months, but in dental, we always recommend 6 months. And if someone has a gum disease, especially senior citizens, then they would need 3 months perio maintenance. And then also combined checkup with the doctors. So that way, if they're having some dry mouth, we will let them know, so that then the medications can be adjusted accordingly, or salivary substitutes can be given. And it's like a multidisciplinary approach. That's why this panel is very helpful, because you get to hear from both the sides. And now there is evolving awareness about gut health, as she mentioned, and we also make sure we educate the patients about gut health, and it is important to maintain a balance.
Thank you very much, Dr. Nisha. It's been great educational topic for myself. I think I need to re-engineer my healthcare as a cardiologist. And Manju, thank you very much for being a guest on
Thank
our
you.
program and
Glad
talking
a lot.
about holiday blues and stress. I am Dr. NIK NIKAM from Triple N Media. Thank you so much for watching this presentation, and I want to thank Ratnakar for organizing all the speakers and the presentations, and also the camera behind standing there. And ladies and gentlemen, please do subscribe to our YouTube channel, and we will see you in the next presentation.